हेलो, गुड इवनिंग, नमस्कार, सलाम, सत श्री अकाल। दोस्तों, आज फिर यहाँ पे हम हाजिर हैं। We are here with one of our very special guest, in a sense that she's not only a guest, she is a very, I think she's like a best friend to all of us. So today we are here with one more topic, and we are going to talk to our panelists, Dr. Jyoti Budi, who is expert. She'll introduce herself. She's coming from downtown Hyderabad. Before I go into detail, I would like Dr. Jyoti Budi to introduce herself. Welcome, Jyoti, on board.
Yeah, thank you, Dr. Seema, for giving this opportunity. And it's always pleasure to talk on very the burning topic at present about AMH, what we are talking today. So, firstly, let me introduce myself. I'm Dr. Jyoti Budi, practicing fertility expert with 18 years of experience in this field. So I am taking care of, I'm the managing director of 49 Fertility Center. It is 7 centers across AP and Telangana. So it's a great opportunity to be in this platform.
So, thank you, Jyoti, for your kind introduction. Please, Jyoti, why did she go down? Okay. So, friends, as we have already discussed about the our change in our social dynamics, our girls, they are getting married late. They are planning their pregnancy and fertility more and more advanced stage, and that is taking its impact on their overall childbearing. Can is someone having two sets? Somebody is live through their two devices. Is So sorry, I don't know. My voice was echoing. So we have already established the fact that our social dynamic has changed a lot, but we cannot just crib about it. We have to think about the solution and how can we help this younger generation to go further, not into their professional career. At the same time, we have to make them understand how important age for and fertility is for them, as nature has made us striving for procreating. So today we are going to talk about few very burning topic, and here with me are my V4, our besties. We are besties. Dr. Anuradha Khan, my co-moderator, she is reporting from 66 AICOG Hyderabad. I just came back from there. Dr. Raj Lakshmi Valavalkar is this side of me. She is from Mumbai, and Dr. Arshi Iqbal from Kota. So we all are sitting at different places, and as I can vouch for it, that all of us are being bombarded by the questions, Doctor, my AMH is very low, and why don't we get it repeated? Maybe it has risen somehow, or why my AMH is so low, and what is the correlation of AMH with our fertility, or what is this AFC? To understand all these intricate details about age, your ovarian reserve is your reproductive potential through which we, the infertility specialists, decide how much time do you have, what are the best ways to make you pregnant as early as possible. So, uh, and I think Anuradha has gone for some time. First question is to Dr. Jyoti.
Yeah.
Please tell me, what is the correlation of your AMH with your age? Why are we talking about age? Why are we worried about our girls getting planning to have pregnancy or getting married late?
Yeah. So it's a very good platform to discuss about age, Seema, because if we see as a fertility expert, when I started our journey 15 years back, 20 years back, if you see the age of marriage, it's according to the latest census, which was released on 2015. It was established in the Indian government census. Just went through about this because I had a presentation of pandemic of AMH. So in that census, what they say is the age of Indian women getting married, maybe because of Indian women empowerment or so many activities which is going on, is shifted for 8 years. If you see 20 years before, most of the women used to get married around 22, 23. Now, if you see in 20 years, the age of marriage is gone to almost 28 years is the peak age where women are getting married. So if you know about fertility, there is something called as window of fertility. Window of fertility is that window which is open. You know, you marry at that point of time, it's very easy. You don't have to chase the doctors. So that window starts at 21 and it so slowly peaks and it is highest at 25 to 29. After that, it's a bell shaped curve, it gradually dips down. So now, if you see the shift in the age of marriage, when the window is closed, women are getting married. That is the time when the AMH is dipping down. So this I have myself created awareness in many platforms about the window of fertility. That is the reason where maybe 20 years back, if you see a woman used to get married at 20, 23, 25, they used to even get tubectomized by 25. Now they're marrying only at 28, where their AMH is dripping down. That is the reason where we see pandemic of AMH in our Indian women now.
That means, yeah, Dr. Anuradha is back. So that means you mean to say the window of fertility, definitely we agree to that, that our women are getting married later now. But what is the correlation of AMH to our age? I would like Dr. Raj and Dr. Arshi to add a few more points. Dr. Jyoti has pointed out a very important point about this window of fertility. We, the reproductive medicine specialists, we are very fond of creating window for everything, be it implantation, be it our window of fertility, and there are so many other windows.
So
Seema,
I would like to add lifestyle diseases, lifestyle factors, the eating habits, the so many issues because nowadays a lot of people are consuming tinned foods or already preserved food. So eating habits have almost changed, and that also adds to the lower downing of this AMH because the overall the deficiencies have increased, lot many factors, the nutrients have decreased and the body is not coping up with all those things. And somehow even if the female who is young enough, 23 to 28, they are also having low enteral count compared to the peers 20 years back. So somewhere these environmental factors plus all these factors are adding up to the age factor also.
see, basically, from my point of view, now we need to explain to girls about two things. Okay, the first thing is that you are destined to become menopausal, and that nobody can stop. And therefore, your ovary starts losing eggs right from the time when you are a baby in your mother's womb. And this rate of loss differs at different times. So there comes a time when the rate of loss of eggs gets accelerated in hopes of taking you towards a menopause. And therefore, this delay of age has basically, so it is just a window in different words, but getting them to understand that menopause is a final truth and nothing is going to be allowing us to increase the eggs or putting eggs from outside into their ovary. That is the first thing that I think we need to get across to our patients. The second thing that we often forget to counsel our patients about, which we should, is that as we are Asians, we are Indians, our ovaries tend to deplete
Yes.
eggs much quicker than your standard white female or your standard African female will. and therefore we tend to have lower ovarian reserves for an age comparison as compared to your white population. What most of the studies until recently, recently we're getting really lovely data from India, but until a few years ago, when we were just starting off with our fertility practices and all, we had only data from abroad. And data for abroad says that a woman can be 43 and go on and have her own baby, but a 43-year-old abroad, okay, for an Asian, 43 years of age, the ovaries might be functioning like a 48 or a 50 or a 52. And that is what needs to be gotten across. So your ovaries age at an average 5 to 7 years earlier as compared to other races. So those are my 2 points to add here.
Thank you. And I think Dr. Anuradha is ready with her question for Jyoti. Here, I would just like to add one point. The meaning of whole of this discussion is that your serum AMH reflects your ovarian reserve or your reproductive potential, and it decreases by age.
With age.
With
Yeah.
age. So
Yeah.
that's the reason why we are so much concerned about your AMH and your age. So, Dr. Anuradha, can you hear me? You are muted. I think AMH has
Yes,
been
I
well
can hear you.
established. Now, a few questions about AFC from Jyoti. Please, you take.
Hello.
Yeah.
Yeah.
Yeah, Anu, we can hear you. Please go ahead.
Yeah. So, Dr. Jyoti, I would like to ask you the importance of ultrasound. Whenever a patient comes, either for a preconceptional counseling, or
Yeah.
even nowadays, girls are coming, they're, planning to get married and they want premarital counseling. So,
Exactly.
or who are married, they want to conceive. So what is the what is the main important investigation which you would like to do first in these patients?
Yeah, exactly. So, very important. Once we know that compared to other women, our Caucasian women, we are running faster, when compared to other women, we have to be very careful. And since so many factors are leading for pandemic of AMH, we should have some valid tool to find the reproductive potential of a woman. So we do have of late many couples coming to us, females coming to us, can we postpone our pregnancy? Example, I had a doctor. She wants to pursue her post graduation. She's in dilemma. She came, sat in front of me. So we have two very important tools. One is immediate scan. So scan ideally done on the cycle day 2 reflects a very beautiful potential of the women's ovary. That is, if you do a scan on early part of the periods on the second or third day, we can see inside the ovary small follicles which are called as antral follicles. So these antral follicles can be counted. The number where there are guidelines which says you can categorize them as a normal, a poor, and a high reserve. So if you see any ovary around less than 5 follicles per ovary, somewhere her number of antral follicles have less for her age. Again, we can compare it with the age. Ideally, younger women's, ideally their antral follicular counts are more. As the women ages, the antral follicular counts come down. So it's very important for us to see a scan and see how many follicles she has. If together, if her follicular count is more than 10, still it's always important to, with a blood test, AMH test, both together, sit and decide with her and say her, yes, your AMH is less than 4 per ovary, with your AMH is less than 1 and your AFC count is very less. So you don't have much time. So this becomes a very important tool for us to counsel and see how, how much time she has.
Yeah. So the basic investigation is ultrasound, where you can count the antral follicles. Now, also, I would like to add a point that even younger patients we are seeing with lower antral follicle count. So even if a patient comes for a premarital counseling, or as you said, she wants to, so we have to do a basic ultrasound. It has to be a transvaginal ultrasound, because of the frequency of the probe, we can count the follicles in a better way. So this is one point which I want to make. And the lowering of AMH or antral follicle count, yes, it is an aging increase in age, you will see decreasing, but now we are seeing even in less than 30 the AFCs are less. And what is the next step you'll do? You've done the antral follicle count. What is the next most important investigation which you would like to do?
So basically, first we do a test. If you mean to say, first is for reproductive potential, we do AFC, then a blood test called AMH, and along with that, even we can do a follicular stimulating hormone test, which we will have an idea of where how much her reserve is. These three tests put together, we can come to a conclusion that what is happening in her ovary.
So,
Yeah,
Jyoti, yeah, please go.
yeah, over to Dr. Seema. Sorry, I'm traveling, so it may
Yeah,
be
that's
little
why I was
dark. And
thinking why
yeah,
dark.
thank you.
So,
Thank you. Yeah,
oh,
I'm traveling. Yeah, thank you.
Jyoti, Arshi, Raj, all of us agree that this antral follicular count as an entity and serum AMH. This AMH is a hormone. It is also known as Mullerian inhibiting substance, which was basically for making these females not to be having male organs when they were in the womb or in utero, has become an excellent predictor of our reproductive potential. So we should be like Dr. Anuradha has given us a very fresh and important perspective of premarital counseling regarding the ovarian reserve. Now, coming to that, this AMH, she might not be very comfortable with antral follicular count. She would not let you do, might not let you do, and we are told that if you are not sexually active, one should defer from doing transvaginal ultrasound. And as Dr. Jyoti said, that FSH hormone is telling the kind of AMH is a quantitative representative of your ovarian follicular count. At the same time, FSH is showing your aging of your ovaries if we take them together. So, Dr. Arshi, do you agree that all these things, AFC, AMH, and FSH, especially AFC and AMH, they are equally important and they should be taken as an ovarian reserve test. And if a patient who comes to you, as Dr. Jyoti said, that if her follicular count is very less when she is put on those ultrasound, especially she's married, or if her AMH is less, than what do we expect when she's coming for this premarital counseling? Do you like advise her for planning fertility earlier, and do they listen to you?
Yeah, definitely. A good counseling is very important right here, because you need to explain each and every aspect of what they will be losing in future if they don't wake up now. That is the most important thing, because most of the people who come to our clinic, they are not aware about the things which can happen to them in the future. So that is the most important thing. They make them sit, understand, counsel about each and every aspect. They will be having early menopause, they will be landing up in so and so things. So definitely it, and the lifestyle changes, what they want to do, why they want to do. And so many times there is a myth that by the age of 45 also they can get pregnant. And most of the people say that those heroine, they are saying, and you are saying that we cannot conceive at 30, our AMH is less. Than why? So there is a misconception in our community regarding this. They say even at 40, even at 45, we can easily conceive. So there is a lack of communication between doctors and patient also. The society too need to educate our new generation about all these things. This should be there in our education system also,
We'll
that
come to
this.
that later, yes, Arshi. And we are happy to announce that our mentor, Dr. Prabhu Mishra, is with us on this stream. Welcome, Prabhu. And he is giving her his inputs from there. He is saying AFC, AMH, FSH, all three are very important. And both oocytes and ovarian cell mitochondria are important for the correct folliculogenesis and oocyte maturation. We completely agree with you, Prabhu. And next time you are going to be inside this stream, I don't know how to take you right now here. So I'll invite you separately and we'll have a separate discussion with our own teacher, Dr. Prabhu Mishra. So till
I
then,
just want to add one point here, Seema. Arshi
yes,
made an
I
excellent
was
point
coming to
there.
you, Raj. Yes, please.
Yeah, sorry. Arshi made an excellent point there. Arshi talked about women at 45 coming with a mindset of मैं pregnant होने वाली थी, कोई हीरोइन pregnant हुई. अभी इसमें दो बातें हैं. Okay. एक तो as doctors we need to we need to remind ourselves and counsel our patients that the ovary is a two-cell system organ. You have one set of cells that are going to give you eggs, second set of cells that are going to give you hormones. Even if the egg cells completely decline, the hormone cells might continue working, and therefore the period might be normal. लोगों को ये लगता है कि अगर पीरियड टाइम पे आ रहा है तो मैंने प्रेग्नेंट होना ही है, लेकिन
Yes.
टाइम पे आते हुए भी अंडे माइट बी नियर जीरो, और जब तक ये उन्हें समझाया नहीं जाता इट्स गोइंग टू बी अ प्रॉब्लम. सो दैट इज द फर्स्ट एक्सीलेंट पॉइंट दैट आशी मेड. द सेकंड पॉइंट इज, अरे हीरोइन 45 में हो गई लेकिन उसने फर्टिलिटी प्रिजर्व करके रखी होगी, उसने एक फ्रीजिंग किया होगा, उसने एम्ब्रियोज बना के रखे होंगे, ये तो कोई बोलता नहीं है पब्लिक में.
Girls, I don't want to go into fertility preservation right now. We have a separate shots for
नो
that.
नो नो, एटलीस्ट 45 उसने इतना बड़ा पॉइंट उठाया कि मैंने कमेंट करनी पड़ी मुझे.
Okay. So here we also have to understand that that antral follicular count, there is a particular size which is only going to get increase in size and which is having that sleeping beauty called as an oocyte who can be awakened at the level of Ellis surge. Not every follicle which is visible inside the ovary is going to give you an egg. So antral follicular count should be done by someone who is very expert like us. We the gynecologists are the best in doing our own ultrasound if we are doing it. So Jyoti, here Dr. Prabhu has made very important point, and that was that nowadays we are, let's keep in mind there are so many doctors also watching this program, so we have to speak about this mitochondrial thing. Nowadays every pharma comes with one product, especially CoQ10, and they'll tell you, ma'am, this product is very good. You have to prescribe to your patient, and she is going to conceive very early. So, what is the role of mitochondria? Does it have any kind of impact on your oocyte quality or oocyte aging? I would like to know from you.
Yeah, basically, if you see the oocyte structure, what is the energy driving for every cell is the mitochondria. It's the powerhouse of any cell. So basically, if you have seen all the papers of late, especially when it comes to the role of antioxidants, there are numerous, elements, micronutrients available in the market. But if you see the research, example, tomorrow is my presentation on micronutrients in the AICOG. So here, what I learned after digging deep into the evidence-based medicine, Cochrane, which is one of the highest authority in our, field, reproductive field. So what Cochrane also has mentioned about role of antioxidants. They do help. It has a low level of evidence, but still clinical pregnancy rates, even live birth rate has increased after the usage of certain type of antioxidants. But issue here with antioxidants, it's like all or none phenomena. Certain set of doctors feel, yes, it is right, I have to use it for all my patients. Certain set of doctors are no, totally to antioxidants. We should strike a balance. When to use, how much to use, where to use, and for whom to use. These 4 points we should understand. Now, if you see about CoQ, there are a lot of studies which says used for 3 months, because our folliculogenesis is for 280 days. If you use it for more than 280 days, there is something happening in the mitochondrial level, and kind of preservation of our aging is also shown in some of the documents. So if you see, CoQ has a role in kind of boosting the mitochondria and then preserving the fertility. So, at certain extent, when a woman has come to me with low reserve, I go ahead and start ultra CoQ to these women, and at least in 3 months, I complete the medication.
So, before I hand it over to Anu, I just wanted to make a point here that this oocytes aging, the mitochondria, which is your power bank energy house, which is going to give it a positive energy going to keep it in positive mode of energy, which is required for this oocyte to grow and divide faster. That is the basic thing to guide to decide the grade of an oocyte. This ages fastest. Mitochondria stops functioning, or its function decreases as our age increases, as the age of oocyte increases. So it's kind of rejuvenation which we are trying to do with CoQ10 molecule, which is also known as mitochondrial rejuvenator. And in this era of regenerative medicine, all these things, why can't we not become menopausal forever? Why can't we live 150 years of life as we are at 20? These are the concepts and which are making their impact, especially through nutraceuticals. So main takeaway point here is mitochondria slows down. That's why we age. That's why a cell ages. And that's the reason these mitochondrial energizer, they are in use. So over to Anu.
Unmute yourself, Anu. Unmute yourself. Anu, you're muted.
Yeah, sorry. Yeah. Now I'm audible. Yeah. My question to Jyoti is, Dr. Jyoti, is that, Dr. Jyoti, you have a patient of, say, 38 years old, and AMH is very low, less than zero point 0.2. Okay. And she says that her periods also have kind of, they come like once in 6 months for last, like, say, 1.5 years. So, what further investigation would you like to do for such a patient?
So
Patient is 38 years old. She has got like every 6 months one period. She was not a PCOD or anything. She just got infrequency like 2 periods in last 1 year, and AMH is 0.2. What, anything further you
So,
want to do test
yeah.
for her?
So, yeah, exactly. This is a common scenario now. We do come across a woman of 38 with very less AMH. So, these women are somewhere going ahead faster for insufficiency, something called as premature ovarian insufficiency. So, these women also come up with some symptoms in history. If you talk to them, hot flushes, dryness, of repeated UTI. These are a set of symptoms, even they come before even the cycle becoming longer. First it shortens, and then it goes for a longer cycles. So one test if we have to do to diagnose according to the definition, that is premature ovarian insufficiency, is a FSH test. Any FSH more than 25, that means she has reached that stage of premature ovarian insufficiency. Not only one test, we need to repeat again 4 weeks apart, again repeat, again it's 25, then we can declare it somewhere she is having this diagnose wise she is reached premature ovarian insufficiency. And if it is 40, 40 is the diagnosis for menopause.
Yeah. So FSH in such cases, when AMH is low, it has a significance. It has a significance in such patients. Now, if a say 30-year-old comes with low AMH and say infrequent periods, like same story what I told, but patient is 30, is there any other test which you would like to do apart from FSH?
Anu, AI
A
COG
scan,
are
basic
better.
scan is very important. A basic scan gives lot of value. First is always the scan. Even before doing a test, I feel first go with the scan, because patient is there, you have an ultrasound with you. Most of the gynecs now have an ultrasound. So do a scan, see the antral follicular count.
So
Also, I want to ask that in a young patient with premature insufficiency, is there the role of karyotyping? Is there role of chromosomal karyotyping? Is it there or not?
I will like to see fragile X. I will like to see a fragile X
We,
in this woman because fragile X is one of the most commonest
as a-
associations of a low ovarian reserve at a younger age group. So typically, if she's less than 30, because at that point she might still give you some eggs. But then if she's a carrier of fragile eggs, then you need to have that counseling session with her, or sort of
yes.
getting a genetic counselor in to try and discuss whether you are going to be using her own eggs or you directly want to go in for a oocyte donor. So karyotype, yes, obviously, because she could be an exo also. You could have a Turner, she could have a Turner mosaic that you're dealing
Yeah,
with.
as mosaic.
But also you basically need to take a look at fragile X also. So
Yeah.
those are the two things that I would like to offer the girls.
so
Exactly, I agree with Dr. Raj.
yeah. So, listening to all of you speaking about premature insufficiency, which has become very prevalent nowadays, I think all of you will agree we are seeing two extreme of population. Either they are
Yeah.
suffering from polycystic ovarian syndrome or they are entering in premature ovarian insufficiency, and this is the group. These two extreme are the groups where the role of FSH as your fertility window comes into play. Like a patient whose AMH is zero point 0.5 nanogram per ml and her AFC is 3 or 4 each side or total 5, but her AMH is 6, our she still has better prognosis than the same picture with AMH of 12, 13, 14, 15. So FSH gives you some you say, what do you call it, some kind of insight towards the qualitative expectation from this woman. Whatever you are going to do, that is going to work for that. And that's why, that's the reason when Dr. Prabhu Mishra also said that if you are trying to get somebody's reproductive potential, you should not only go with AMH and AFC, you should also look at her FSH. Why am I
FSS.
repeating it? Nowadays, all the reproductive medicines specialists, they do not believe in doing AMH of their doing FSH of their
FSH.
patient. And we are told that we just have to do FSH and antral follicular count. Somehow I don't believe it. I believe in complete diagnosis of the lady, and that accordingly I prescribe the treatment. So it has been really, really interesting discussion till here. Now मैं अपने हिंदी दर्शकों के लिए थोड़ा सा इसको हिंदी में बता दूं। दोस्तों, आज हम लोग बात कर रहे थे उम्र के असर का हमारे प्रजनन क्षमता पे या रिप्रोडक्टिव पोटेंशियल पे, जिसको नापने के लिए हम डॉक्टर्स के पास कुछ चीजें हैं। उसमें से दो ब्लड टेस्ट हैं, एक सीरम AMH एंटी मलेरियल हार्मोन, जिसके बारे में मैंने बहुत बार आपसे बात कर रखी है, एंड फॉलिकुलर स्टिमुलेटिंग हार्मोन, जो बताता है कि आपका ये जो पीरियड आने का टाइम है। डॉक्टर अनुराधा ने, डॉक्टर अनु ने, डॉक्टर डॉक्टर राज ने, ज्योति ने, आरती ने, सबने ये बात बोली कि ये जरूरी नहीं है कि पीरियड आने का मतलब है कि आपको बच्चा भी हो जाता है। हमेशा जब आप हमारे पास आते हैं तो बोलते हैं, मैडम आप कैसे कह रहे हो कि आपके पास, मेरे पास अंडे नहीं है, हमको तो पीरियड एकदम रेगुलर आता है। तो पीरियड जो होता है बंद होने के 8 से 12 साल पहले आपकी प्रजनन क्षमता लगभग लगभग शून्य हो जाती है। तो अगर आपकी 47 साल से 49 साल है मेनोपॉज की एज इंडिया में, तो हमारी प्रजनन क्षमता सोचिए 35-37 में उतनी कम हो जाती है जितनी विदेशियों की 42-43 साल में होती है। तो ये रीजन है जिसकी वजह से हम आपके रिप्रोडक्टिव पोटेंशियल की जांच करते हैं ब्लड से। FSH आपके मेनोपॉज की तरफ, आपके प्री मेच्योरली मेनोपॉज की तरफ जाने के बारे में बताता है। AMH आपके अंडे के नंबर्स के बारे में, जो हमको अल्ट्रासाउंड पे भी नहीं दिख रहा है, उसके बारे में बताता है। और अल्ट्रासाउंड जिससे हम आपके अंडे काउंट कर पाते हैं, वो एंट्रल फॉलिकुलर काउंट, वो AMH के साथ आपके क्वांटिटी के नंबर ऑफ उसको बताता है। और ये सारी चीजें एज डिपेंडेंट है। मेजॉरिटी ऑफ लोगों में एज के साथ ये घटती हैं। AMH घटता है, AFC घटता है, लेकिन FSH बढ़ता है। इनका आपस में उल्टा रिलेशन होता है। जब FSH बढ़ेगा तो AMH और AFC को कम होना चाहिए नेचुरली, लेकिन कुछ केसेस ऐसे होते हैं जहां पे उनका FSH अभी खूब घट जाता है और AMH वगैरह कम घटते हैं। इनका वो विंडो है जिनको ये अपने डॉक्टर से मिलना चाहिए और जल्दी से जल्दी अपने फर्टिलिटी प्लान कर लेनी चाहिए। ऑन कॉन्ट्रेरी, कोई महिला है जिसको पीरियड देर देर में आ रहा है, उसका FSH 15 है, AMH की जानकारी है नहीं, 20 है, 25 है, जैसा डॉक्टर ज्योति ने कहा, वो प्री मेच्योर ओवेरियन इनसफिशियंसी की ओर जा रही हैं, जो आगे चल के प्री मेच्योर मेनोपॉज में चेंज हो जाएगा। तो ये वो लोग हैं जिनको अपने करियर को हॉल्ट दे करके और यहाँ पर एक बार अपने फर्टिलिटी पोटेंशियल के बारे में और क्या वो जिंदगी से चाहते हैं इसके बारे में जरूर सोचना चाहिए। उन्हें बच्चा कैसे करना है, ये डोनर वगैरह की बातें बाद में होंगी, लेकिन पहले आपको ये डिसाइड करना है कि आप क्या चाहते हैं। तो एज इस पे सबसे बड़ा प्रभाव डालती है दोस्तों। तो एज के साथ ये चीजें बदलती हैं। जैसा डॉक्टर राज ने कहा, मेनोपॉज नहीं बदलने वाला है, दैट इज एन यूनिवर्सल ट्रूथ टिल नाउ, दैट वी आर गोइंग टू गेट मेनोपॉज, और उसके 10 साल पहले से हमें बच्चा होना बंद हो जाएगा। तो हमें अकॉर्डिंगली प्लान करना है। आई वुड लाइक अनु टू टेक द शॉट्स टुडे। Unmute.
Sorry. My first shot. Ovarian aging is inevitable. Can you hear me?
Yeah.
Ovarian aging is inevitable. Do not postpone your marriage or childbearing to an extent that it is beyond repair. Third, do a counseling at around 20, less than 25. I would say you should do your AMH at least once. Don't think you are young, nothing will happen. But I'm seeing even at 23, 24, 25, AMHs are going down. So 25 se pehle, before 25, also do one AMH. Be in touch with your gynecologist if you want to postpone your childbearing.
Excellent. So let me explain to our esteemed guest, Dr. Jyoti Budi, that here we are taking few shots. Fine.
Okay.
So at the end of the discussion, all of us have to give at least 3 shots about the topic we have discussed already. So Jyoti, it's your turn now. Since Anu is traveling, I thought her connection might get lost. So I asked her first. Otherwise, this is given to our guest first. She has to give us 3 shots.
So yeah, so I will always go with prevention is better than cure. So, as Dr. Anu has told, get an AMH evaluated. Whatever you're either married or going to get married, first get your AMH, because we as doctors want to make you the genetic mother. That is something which every lady has to undergo. So, genetic mother, if it's very important, get your AMH tested and also a antral follicular scan done, basic scan. And if you want to postpone pregnancy, see a gynecologist. You don't decide yourself. And then lifestyle, definitely very important. The way we are going now, women empowerment, I do agree. But what I say is, as our elders have told, within 30, try to complete a family. You don't have to run around doctors. Very important. But still, if there is so many issues, we can't force everybody to complete a pregnancy within 30. At least see if you have time, get your oocyte preserved.
Thank you, Jyoti. Now it's Arshi's turn today to give her 3 shots. She's waiting eagerly. Nobody is letting her speak. You are muted.
Archie, unmute.
Yeah,
Unmute.
most of the points have been covered. So I was thinking what to say. So my first message is, if you, before marriage and post marriage, please go to your fertility consultant and get a counseling done. That is very important. Whether you are good or bad, let your consultant decide, a specialist decide, and tell you each and everything which you are not aware about it. Don't go on Facebook and YouTube. Better to go to a specialist and get a counseling done. That is the most important tool. Don't listen to Nadi Nani. Go and talk, because the era has changed. So consult a specialist first. Second is, you need to decide the priorities in your life. First, a child or your career. I agree, career is important, but you have to wait between two, which is more important for you. Career can wait for 5 years, but your fertility, which is going down every day, will never wait for you. And then you will be waiting for donors. So, for yourself, being the original mother, genetic mother of the baby, career can wait for 5 years. I'm not against career, but people will think, but babies are very important. And third take home thing is lifestyle. That is the utmost things. Your brain health, your mind should be healthy. The condition, you should not be in this depression, because most of the couples, when they are not conceiving, they have depression side by side, which is obvious. You cannot understand you are having depression. So the mental health is also very, very important. And for that, yoga, exercises are very important to go along with every day.
So, Raj, I think Anu and Jyoti and Arshi, they have taken the social part. Here, I would like you to give those 3 shots based on AMH, AFC, and age and medical terminology.
Okay. So my first shot is age. Okay. हम हिंदुस्तानी दुनिया में हर चीज में आगे हैं except our potential for fertility we lose it early. हमारे ovaries अंडे जल्दी खत्म करते हैं as opposed to anybody else in the world, and therefore we need to be really मेरे पीरियड्स अच्छे आ रहे हैं इसलिए मेरी फर्टिलिटी अच्छी है ही, इस भ्रम में ना रहे। You need to start working and thinking about proactively about planning your family. So age is extremely important there. सेकंड, जब डॉक्टर आपसे कहे कि एक सोनोग्राफी करवा लो एएफसी के लिए, दैट सोनोग्राफी अगर इंटरनल सोनोग्राफी करने की बात आती है तो प्लीज हाँ कहें, बिकॉज आप अगर पेट से सोनोग्राफी
I
करते
love
हो,
a Hindi.
पार्डन, यू लाइक
I
हिंदी
love
जल्दी,
your Hindi.
नहीं बिकॉज आपके ऑडियंस इतने सारे हिंदी में है, हम अंग्रेजी में बात करते जाते हैं, तो आई एम ट्राइंग टू डू अ लिटिल बिट इन हिंदी। तो अगर आप पेट से सोनोग्राफी करते हो तो पूरा पेट के मसल्स आ जाते हैं, फैट आ जाती है, यूट्रस इतना सा छोटा सा वो पीछे बोन के पीछे रहता है, ओवरीज उसके पीछे जाएंगी। पेट के सोनोग्राफी पे सब कुछ ठीक तरह नहीं दिखता। अगर
राज
आप
में राज 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 मैं यहाँ पे रोक के बस ये बोलूंगी कि मैं अपने पेशेंट्स को बताती हूँ कि पेट के ऊपर से सोनोग्राफी करने का मतलब है कि मैं यहाँ बैठी हूँ, तुम मेरे छत में छेद करके मुझे देख रहे हो।
गुड
और
वन,
और
गुड
टीवीएस
वन,
का मतलब है ये सामने दरवाजा है, इससे तुम आकर के मुझे देख रहे हो, तो सोचो दोनों में कितना अंतर होगा।
absolutely. So that is the other thing. And PCP, the third shot, is for a gynecologist. बिकॉज एफएसएच अपने पेशेंट्स नहीं समझने वाले। आप जब भी एएमएच और एएफसी देखते हो, इफ यू डू एन एफएसएच एट द सेम टाइम, और अगर आपका एफएसएच आपको फॉर द फॉलिकुलर पीरियड फॉर द एज हायर साइड पे लग रहा है, तो आप पेशेंट को अकॉर्डिंगली काउंसिल करें एंड टेक एन एक्शन अर्ली। एफएसएच को एकदम 12, 15, 18 होने तक ना रुके। और मैं खुद सिर्फ एफएसएच पे नहीं रुकती, मैं जनरली एलएच, ईस्ट्राडियोल, थायराइड एंड प्रोलैक्टिन सब इकट्ठा देखती हूँ, बिकॉज ये
मी
सब
टू
हार्मोन,
मी टू
या बिकॉज ये सब हार्मोन्स ना एक घड़ी के व्हील्स की तरह होते हैं। एक पहिया दूसरे में अटका रहता है, इकट्ठा घूमता है। एक भी निकल गया, आपकी घड़ी बंद पड़नी है, फास्ट जाएगी, अंडे जल्दी खत्म करेगी, स्लो तो वो कभी होती नहीं। इस पर आपको ये सब हार्मोन्स इकट्ठा देखने हैं। तो दीज आर माय 3 शॉट्स।
Thank you. So let me be the devil's advocate here. We, the gynecologists, we think if we just ask for so many tests, this patient will run away to some other gynecologist. So please don't get scared. Instead of writing so many things to eat, just get her properly investigated and look into that reproductive window, which is very, very important. Don't waste that time by, as Dr. Raj said, her AFSH to reach to a level from where she cannot return to normal pregnancy. Second thing, parents, you have to understand that the gone are the days when you got married at 16 and 17 years of age and you got your first child when you were 26, means 10 years post marriage. Don't give the same advice to this generation who is already getting married at 28 to 30. So age and duration of marriage does not matter. What matters is age, and that is declining your daughters or your daughter-in-laws potential or your sisters-in-laws potential to become a genetic mother. And doctors, please go into detail, see the importance of age and its impact on the ovarian reserve. And if you cannot deal with it, just refer her to your friend who is dealing with that. With this, I would like to say goodbye to all of our esteemed audiences. Because of them we are here, and we are glad that you are giving so much love and affection to us. हमारे वीडियोस एक तरह से वायरल हो रहे हैं, हर प्लेटफॉर्म पे इनकी डिमांड बढ़ गई है, लोगों के बीच में डिमांड बढ़ गई है। कल हम ऑफलाइन थे, लोगों ने पूछा कि मैडम आज आपका शो क्यों नहीं हुआ। तो कल हम फिर एक टॉपिक के साथ उपस्थित होंगे दोस्तों। तब तक सोचिए, मैं अपनी बात कर सकती हूँ, अनु की बात कर सकती हूँ, राज और अर्शी छोटे हैं, ज्योति भी यंग है, इनकी बात नहीं कर सकती हूँ। लेकिन मैंने 12 साल अपनी, आज से 10 साल पहले मैंने प्रैक्टिस करना शुरू किया था। मेरी प्रायोरिटी थी कि मेरा बच्चा, पहले बच्चा हो जाए तो ठीक है, उससे कोई फर्क मेरी जिंदगी पे नहीं पड़ा, मेरी प्रैक्टिस पे नहीं पड़ा। हो सकता है बहुत सारे लोग इससे नहीं एग्री करेंगे। एज अर्शी सेड इन द बिगिनिंग, प्रायोरिटाइज, आई विल एड कंपार्टमेंटलाइज, कि आप डिसाइड करिए कि कौन सी चीज के लिए बेस्ट टाइम क्या है। करियर में थोड़ा मेहनत करना पड़ेगा, आगे बन जाएगा, लेकिन जो लूज हो गया बायोलॉजिकली, जो नेचर ने किया है, उसको हम रीगेन नहीं कर पाएंगे। तो हम सीईओ बन सकते हैं 40+ पे, लेकिन 50 पे हम मदर नहीं बन सकते हैं जेनेटिक। तो ये बहुत इंपॉर्टेंट है। एज अ डॉक्टर जब तक हम आपको ये बताएंगे नहीं, इसकी इंपॉर्टेंस आप नहीं समझेंगे, हम आपको जज नहीं कर रहे हैं, हम आप पे अपना डिसीजन थोप नहीं रहे हैं, हम सिर्फ आपको बताने की कोशिश कर रहे हैं कि आपके लिए अच्छा क्या है। थैंक यू गाइस, टेक वेरी गुड केयर ऑफ योरसेल्फ। हैदराबाद बहुत गर्म था, लखनऊ ठंडा है, सब लोग अपना ध्यान रखना। गुड बाय, शबा खैर, गुड नाइट। थैंक
Good
यू
night.
डॉक्टर ज्योति बुड्ढी, डॉक्टर अनुराधा खार, डॉक्टर राज एंड डॉक्टर अर्शी, और हम चारों की तरफ से भी प्लीज अनु से थैंक्स टू ऑडियंस एंड ज्योति।
Thank you so much, Dr. Jyoti and everyone. Thank you so much. And I would like my Isarians again. I want to remind them that Dr. Seema Pandey is contesting for the post of librarian, for honorary librarian for ISAR elections. The voting will start from 11 January, 10 a.m. Kindly vote for her. And I am standing for member managing committee ISAR, and kindly vote for us and give us your valuable vote and support us. Thank you so
अच्छा,
much.
अच्छा अनु, मेरे दर्शक पूछते हैं, मेरे पेशेंट पूछ रहे हैं, वो भी वोट कर सकते हैं क्या? तो मैं
नहीं,
उन्हें
So nice.
I'm sorry, I'm sorry, पब्लिक वोटिंग नहीं है। ये हमारा डॉक्टर्स का एक इलेक्शन है, उसमें गायनोकोलॉजिस्ट होते हैं और मेनली जो है इनफर्टिलिटी जो प्रैक्टिस करते हैं, जो
जो इसार
बांझपन का
मंडल है,
इलाज करते हैं, वो लोग ही सिर्फ वोट कर सकते हैं। थैंक यू।
जो
Yeah, I will
इसार
vote for my
मंडल है वो
my
यूज
dear
करेगा।
Dr. Seema Pandey and Dr. Anuradha, most deserving candidates and real people with lot of good work for our research.
I
Thank you so
agree with
much for
them.
this opportunity. Bye bye.
Thank you, Jyoti. It was lovely having you on board. We'll call you again. Till then, please
Yeah,
take care. Thanks a lot.
thank
You
you.
just came on one invite few hours back.
Thank you. Bye bye.
So,
अरे वो छोड़ती है।
Kanishk, बंद करो।